Hi, this is Jeff Welch. I'm CEO at Florida Medical Center, and I'm here with Dr. Zagha today. Thank you for joining us, Dr. Zagha. What do you do at Florida Medical Center?
So thank you, Jeff. I am the current Chief of Staff here at FMC. I'm a urologic surgeon, and I've been at Florida Medical Center for 14 years.
So we're here talking today about the whole COVID-19 pandemic, and what safety measures do you feel have been put in place to protect our patients?
Sure. So for surgical patients, safety has always been a top priority from the moment you enter the building, throughout your surgical stay here, and the time you leave. In addition to our routine safety measures, we have also instituted careful cleaning of patient areas, surgical rooms, in addition to checking COVID-19 status of our patients preoperatively.
So Governor DeSantis has opened up for elective cases on May 4th. Is it safe to have an elective case?
It is safe to have your elective surgery here at FMC. In addition to our routine safety measures and our enhanced safety measures with COVID testing, we do have plenty of personal protective equipment, or PPE, here for our staff and our patients, and we do ensure that your stay here with us will be safe.
What types of urological conditions or symptoms should be treated immediately?
So conditions that I deal with can affect patients, their health and their livelihood. Some can even lead to death if not treated. Conditions which cause renal obstruction or urinary obstruction, like kidney stones or cancer, should be treated more immediately.
So next month, June, is Men's Health Month, and as a result, what are some of the top health concerns of men today?
Sure. So for men, quite often, most of the concerns stem around the prostate, which concern conditions of prostate enlargement, which can affect the urination. Also prostate cancer, which can also affect your life, which should be treated and found early if possible. Other conditions that I see involve erectile dysfunction, testosterone, and for other patients, vasectomy and circumcisions.
So screenings, or the amount of screenings, tell us what's available and how many times we should be screened.
Sure. So screening for prostate cancer is a case-by-case basis. We do recommend screenings generally at age 50, although if you're African American or a strong family history, sometimes we start those screenings earlier at age 40. Screenings typically involve a physical examination and a blood test called a PSA.
So, and what is PSA?
That's a prostate-specific antigen. It's a blood test that is basically a protein found in your bloodstream of circulating prostate proteins. And we're going to compare that to your prior test and see if there's any change year by year.
So one of the big concerns after going through this COVID-19 in the past 10 weeks, there's a big concern about delaying care. What is the concern there about delaying care, and should people be concerned about this? Should they delay their care, and what's your recommendation?
Sure. So each condition, each patient should discuss with their doctor regarding delaying of care. Some conditions or mild conditions may be appropriate to delay care at this point, but for the majority of conditions at this point, we're recommending that you do proceed with caution regarding your medical or surgical treatment.
Are there potential concerns if you do delay your care?
Sure. Again, certain conditions such as cancer, or in my case, urinary obstruction, kidney stones, can progress and can be life-threatening if you do delay too long.
Well, that's really helpful to the viewers, Dr. Zagha. I appreciate your time today. Thank you for everything you do. The physicians are on the front lines as well. You're dealing with the patients every day, and it's commendable, and you are true hero, and the rest of your colleagues. So with that, I'm Jeff Welch. Thank you.